My name's Kay Mohanna. I'm a GP and I'm Professor of Medical Education at the University of Worcester in the UK. And I'm the International Development Advisor for the Royal College of GPs, for the membership of the Royal College of GPs International Exam. And how did I get here? Well, it just kind of by luck and coincidence. I was a researcher originally, looking at the reasons why pregnant women don't want to participate in research. So that was my very first start in academia and starting as a researcher, and then I moved into education, and I'm a GP trainer in our practice, and things just grew from there. So I'm a member of the advisory board for the family medicine program, and I'm currently teaching on the teachers course. So one of the key ways to set up a safe training environment is to make sure you have properly trained trainers, and the department is working really hard on that and already has a big cadre of very experienced trainers, so I feel myself very privileged to be part of their learning journey and to try and learn from them about how things are, and maybe if possible give a little back in terms of teaching methods. So I'm a GP, so I believe passionately that all patients should have access to a family physician. It seems to me like a no-brainer. You can't have universal health coverage without a strong primary care sector, and that primary care sector has to have fully trained family physicians who are able to manage unfiltered care. So patients can come with anything. Patient has tummy ache. How do they know? Do they need a gastroenterologist? Do they need an obstetrician? Do they need a psychiatrist for their tummy ache? So we can advocate for them because we can distinguish at an early stage which one it might be. We're of course not always right, but we have some way of filtering that through, and we can help the patient make a choice. So I think it's the most important specialty. The main element is to be a role model. So you have excellent faculty here who understand the holistic nature of what it is to be an excellent family physician, and they are then role models for others who can look. And I heard it from the residents this morning. You know, our teachers are inspirational, and they are, you know, giving us the sense of professional pride. So Indus is doing this and should be doing it. Your question is, what can they do? It's about role modeling, professional self-esteem, but it's also about taking people who the brightest and best, who want to be at the forefront, right close up to the patients, and helping them. One of the reasons why I'm a GP is because, you know, we're very privileged in the West. You know, people do have access to their GP, as they call them. And because I'm kind of a nosy person, and I'm kind of interested in people, and I'm interested in their life and their experiences that have made them the person that they are, I'm a GP. And I think that that's the kind of attributes that I'm seeing in these residents. They're curious and they're interested, and Indus is supporting and sparking that, and that's the main role. Yeah. So we want people to become GPs by choice and not by chance. So if I had to define Indus College of Family Medicine and Public Health, I would say it's an institute with exceptional leadership. And that's crucial because the tone of an organisation is set from the top. And there is a facilitative, collaborative approach to bring in expertise from wherever it's found, in the benefit ultimately of the patients. You know, we're all about the service to patients. Through benefiting our residents and our undergraduates, we benefit patients.